The patient that you're caring for in ICU is starting to increase the need for their norepinephrine drip, and your provider just ordered vasopressin to go with it. Let's talk about what you need to know as a bedside ICU nurse caring for a patient on vasopressin. My name is Leah. I've been an ICU nurse for 19 years, and today we're going through a series on drips in the ICU, and we're going to focus on vasopressin. So whenever you have the medication vasopressin, you should know that it activates the V1 and the V2 receptors. So when it activates the V1 receptors, we're going to see things like peripheral constriction, which is going to increase our SVR and increase our blood pressure. And with the V2 receptors, we're going to see that it's going to increase water reabsorption. Now, why do we do vasopressin? We don't titrate it, but we are going to have it indicated as a second line whenever our patient is already on another vasopressor when they're in shock, especially septic shock. Any kind of vasodilatory shock would be this case, but we use it a lot at the bedside with septic shock. So the set dose that we normally see in most ICUs is 0.03 to 0.04 units per minute. Check your policy and protocol. Some places do still titrate it, but the reason that we don't see it titrated higher above 0.04 for the most part is because of the complication that's most associated with it, and that is an increased risk for peripheral and mesenteric ischemia. And we see it even more at the higher doses. So that's why you won't see it as commonly above that dose. So most places do at least have a set high dose, even if it is able to be titrated. So if you're assessing a patient to see how this medication is working for them, you would be looking to see if we're able to keep the MAP where we want it. Above 65 is what most places are going to want without having to increase our norepinephrine drip. But you're just going to keep reporting to your provider if you have it at the set dose and you're still having to go up on your norepinephrine so they can decide what they want to do next. So continue to follow along with this series. We're going through drips in the ICU. If you want more content like this, I have a course linked in my bio, and it is for nurses who are new to ICU, whether that's from brand new nurse, new grad nurse, or if you're transferring in from somewhere else. Continue to follow along.